Cervical cancer is a very common disease worldwide. In most countries in the world, it's a lethal disease because there is no treatment available.
8 out of 10 of those deaths will occur in low and middle income countries. Even in Australia, there are groups like First Nations women, migrants, refugees, where death rates are much higher because of poor uptake of vaccination, poor screening, and so on. Cervical cancer is a devastating diagnosis. It doesn't respect age, it doesn't respect status.
I was diagnosed in 2016. I was about 38 years old. I was at a GP visit. There was some high-level changes on my cervix, and I then had to go to a gynaecologist who then confirmed a cancer diagnosis, cervical cancer. So I had a total hysterectomy, which meant removing my cervix, uterus, fallopian tubes, and all my pelvic lymph nodes. I think it has taken a huge toll emotionally and physically as well, just on my body. And it's sort of still ongoing today, you know, it's almost 7 years later.
The normal way of going about making a vaccine is to grow up something that looks like the infection you want to prevent. But none of that was possible with human papillomavirus because nobody could grow the virus. So there was a gap until the new technologies of molecular biology came along, and we were able to show quite clearly that not only could we build something that looked like the virus, but also was able to induce antibodies to protect against infection. And I was excited because I thought we now might have a vaccine.
In Australia, within 4 or 5 years of starting the vaccination program, rates of HPV infection dropped by almost 60%. There are very few interventions in medicine that have such an immediate impact, not just at a personal level, but at a population level as well. It's now anticipated that if you're a young woman born in 1995, your risk of cervical cancer is almost eliminated.
Knowing now what I've gone through, knowing that, you know, my kids won't ever have to go through that, just massive relief.
It would be fair to say that almost all of the work we did in the first 15 years I was here was funded philanthropically. Competitive funding comes from what you have already achieved. Philanthropic funding takes the promise of what you think you might achieve and tries to fund it to help you get there. And that's a very important distinction, and it does encourage people to take much more risk. The real value of the vaccine would have to be from using the vaccine in countries where screening is not available. The Gates Foundation and others recognised this and provided money to help get the vaccine out there into the developing world.
If you have an effective vaccination program, more than 90% coverage, you are likely to save more than 300,000 lives every year. The saving from reducing the number of women affected with cervical cancer is in the order of tens of millions of dollars to the healthcare system. Ian's research has resulted in such a major transformation of so many women's lives across the world. The impact just cannot be overstated.
Now that I've had the vaccine, it makes me feel a lot more relieved and lucky, and seeing what can happen firsthand, it just made me realise how really important it is for people to have access to it. So I don't even have to think about that being a possibility for my health, and just really lucky and fortunate.
Without philanthropy, it's very difficult to start solving a new problem. Scientific research is very much a team activity, and we have to recognise that philanthropy is a critical part of delivering research to the benefit of humankind.